Struggling with tenses in OET writing? In this video, we'll cover the most useful tenses you need to write clear, accurate, and professional letters. Let's get started. Grammar is essential in OET writing because it ensures your message is clear, professional, and easy to understand. Using correct grammar helps you communicate clinical details accurately, which is crucial in healthcare settings. It allows you to express the patient's condition, treatment, and progress without confusion. Most importantly, it prevents misinterpretation in referral letters, where even a small error can lead to misunderstanding. Good grammar builds trust and reflects your competence as a healthcare professional. In OET writing, using the right verb tense is key to presenting clinical information clearly and accurately. The present simple tense is used for current conditions or ongoing routines, while the present perfect tense helps describe recent changes or progress relevant to the present. The past simple tense is commonly used to report completed events like hospital admissions or treatments. For events that happened before another past event, the past perfect tense comes into play. Although future tense is rarely used, it may appear when discussing upcoming appointments or plans. Understanding when to use each tense helps you create professional, well-structured referral letters. The present simple tense is commonly used in OET writing to describe the patient's current situation or general medical facts. It's perfect for stating symptoms, ongoing conditions, or regular routines. For example, the patient complains of severe back pain, or she suffers from chronic hypertension, clearly tells the reader what is happening right now. It also works well for routine treatments like, he currently takes aspirin 75 milligrams daily. This tense keeps your writing straightforward and helps the reader quickly understand the patient's present health status. The present perfect tense is used in OET writing to describe recent events or changes that started in the past and are still relevant to the patient's current condition. It helps link past actions to the present, giving the reader important context. For example, the patient has experienced worsening joint pain over the last month, shows a symptom that's ongoing, while he has been taking paracetamol for the past 2 weeks, highlights a treatment that's still in effect. This tense is useful when you need to show progress, response to treatment, or developments that impact the current clinical picture. The past simple tense is essential in OET writing when describing events or actions that are completely in the past. It's commonly used to explain medical history, previous treatments, or past symptoms that have since resolved. For instance, the patient underwent knee surgery in 2020, or he presented with a high fever 2 weeks ago, clearly indicates that these events are no longer current. This tense helps set a clear timeline and provides the reader with important background information without confusing it with the patient's present condition. The past perfect tense is useful in OET writing when you need to show the order of past events, especially in medical history. It helps clarify that one event happened before another in the past. For example, the patient had been experiencing intermittent chest pain for several months before the diagnosis, makes it clear that the pain started well before the diagnosis was made. Similarly, she had completed a course of physiotherapy prior to being referred to you, shows a clear sequence of events. Using past perfect tense ensures your writing is accurate and the timeline of care is easy to follow. In OET writing, the future tense is used sparingly but effectively, especially when discussing expected outcomes or making polite recommendations. It's helpful for indicating what is likely to happen next in the patient's care. For example, the patient will require further evaluation, or she is likely to need additional tests, sets clear expectations for follow-up. This tense is also useful for suggesting potential benefits, such as, I hope the patient will benefit from continued therapy. Using the future tense appropriately adds a professional tone while guiding the next steps in patient management. In OET writing, combining different tenses throughout your letter helps create a clear and professional flow of information. In the introduction, the present simple and present perfect tenses are ideal for describing the patient's current condition and any recent developments, e.g., Mr. Smith has been experiencing severe knee pain for the past 3 months. The body of the letter typically includes past simple and past perfect tenses to explain medical history or previous treatments, while the present simple is used for ongoing issues, e.g., he underwent surgery in 2021 but continues to report discomfort. Finally, the conclusion often uses modal verbs and future tense to make polite recommendations or outline next steps, e.g., I would appreciate it if you could assess and manage her condition. This mix ensures your letter is accurate, structured, and appropriate for the clinical context. Mastering verb tenses in OET writing is key to writing accurate and professional letters. Always choose the correct tense based on the timeline of events. This ensures your meaning is clear and clinically appropriate. Be consistent with your tenses throughout the letter, and double-check for common grammar mistakes during proofreading. A frequent error is mixing past and present tenses within the same sentence, which can confuse the reader. Also, avoid using future tense unnecessarily, especially in referral letters where the focus is on current or past care. Don't forget to use the past perfect when describing events that happened before other past events. These small details can make a big difference in the quality of your writing. Thanks for watching. Don't forget to like, share, and subscribe for more OET tips. See you in the next video.